All right, go ahead and get started. Thanks for joining the webinar today. My name is Kevin Phillip, and I'm joined with my colleague from Crisp Shared Services, Francesca Charles. She's going to be leading us through this presentation about clinical reportings, the new reporting tool that the reports team has developed. This webinar is intended for the points of contact. So today you'll learn a little bit about some background of the tool, but mainly how to credential users to access this new reporting suite. Before I turn it over and we jump into the content for today, I did want to cover some housekeeping items. So first, we are recording this session, and we will share the recording and the slide deck to all attendees. Um, we have additional sessions that we intend to have cover the same content, one on Thursday of this week, and then one next Wednesday. So if you have a colleague who's a point of contact with you at your organization who you think would benefit from this training, feel free to share the sign up links for those to those attendees, and they can join and get the same level of training that you have. If you do have any questions, you can type them into the Q&A feature, and we will have some time at the end to go through your questions. Or if you think of them later, you can reach out to our support team at support@crisphealth.org, or reach out to the reports support team at reports/support@crisphealth.org. So there's many ways to get in contact with us. We will also share a user guide along with the presentation materials and the recording. Okay, I think I have talked enough, and I will now turn it over to Francesca, who will cover the main presentation for today. So I'll turn it to you.
Thank you, Kevin. That was a fantastic intro. Good afternoon, everyone. As Kevin stated, my name is Francesca Charles. I work with the CRS team as a project manager. We developed a new reporting suite. It's a new application on the HIE portal available to you now. If it is not on your dashboard, it will soon be available to you. Called clinical reporting. And I will move to our next slide. As Kevin stated, today's training session is really to provide you with an overview of our new tool and how we have integrated that feature into the reports role manager, which you've used to previously credential CRS reports. And I will do a brief slide to distinguish between the difference between what CRS is and what clinical reporting, what we're considering the differences are. So we wanted to provide an overview. We'll do this particular slide and a few other slides just to touch on what clinical reporting is. And I will walk you through the process today, not only through the slides, but I'll also demo the dashboard, the clinical reporting dashboard, one or two of our existing reports so that you can have a quick view of it and be able to determine the type of users at your organization that would most likely have the most use for a clinical reporting tool. I will walk you through the process of credentialing a new user through the HIE admin tool, as well as role manager. So we are going to cover quite a bit today. Clinical reporting is a new CSS product and a service that was curated within our internal teams, Insights, and CRS. We partner with our state agencies, different hospitals, and primary care to really determine what the best type of reporting suites would be, what would be most valuable for users who are interested in accessing near real-time clinical data on their users. And so our reports are built internally. We are not partnering with a third-party vendor. The data sets, which we'll take a look at now, are we're pulling directly from our ADTs and the patient panels that participating organizations are sharing with Chris. And so the data source is participant shared patient panels, which we're pulling out the demographic data that we're receiving through our ADT feeds, and as well as the CCD elements that are available directly into our ORUs, and of course, lab data. We're also filtering in some SDOH, HRSN assessments, and referrals. Now, in terms of use, of course, if the participant is not registered with the organization, with CRISP, and are not sharing data, then that information will not be available in the reports, as well as individuals or patients who have opted out of having their information in CRISP. The existing reports, we currently have 4 reports that are available to Maryland, and we are also in the process of creating 2 new dashboards that will soon be available midsummer. Our first report is the panel demographics report, and that report provides a demographic overview of patients that are on your patient panel. It does show the chronic conditions based on the ICD-10 codes that we've received, and it also allows for users to track trends and provide support for additional care planning that the beneficiary may require. This particular screenshot of the panel demographic dashboard can really show you how these reports are being developed through Power BI. And we have a series of filters, as well as a data dictionary and some charts that allow you to, I would say, create target population outreach based on the demographic or the particular chronic condition that you're working with. Our second report is the hospital revisit report. And the hospital revisit report is somewhat of a readmission report in order to help prevent readmissions. So it does highlight any potential patterns that are related to frequent utilization and allows for users to provide that additional support for care coordination and quality improvement initiatives within each of your facilities. Additionally, we are offering a perinatal referral dashboard through the IMHS programs in Maryland. The MDH IMHS perinatal referral suite is population level. It is an aggregated report that allows for the tracking of referral trends over county, by age, by gender, so various demographics. The IMHS perinatal facility referral report, that report is a patient level summary dashboard that allows for organizations like ACOs or LHDs and MCOs to track the IMHS referrals that their organizations are supporting for their patient population. It does highlight any county insurance types and rejection reasons as one of the main dashboards that are available within this particular report. So very real time, or near real time rather, data flowing through the clinical reporting suite. So what is the difference between the existing CRS reports and clinical reporting, and why did we decide to create a clinical reporting suite? The CRS charts and suite of reports. Those are created by an organization called H Metrics, and they support CRISP in providing claims-based data or claims-based reporting. Those reports are extremely dynamic, but there is a lag in terms of how quickly those reports can be updated due to the time frame that it takes for Medicaid claims to be processed. With clinical reporting, as I've mentioned, it is a more near real time, and we are using clinical data that has been shared directly with CRISP from the organizations that we partner with in Maryland. And so that is also developed internally, and the dashboards are extremely dynamic. And so that is the main difference. Our internal reporting, clinical reporting suites do not contain claims-based reporting. They're mainly clinical database, and that is through our ADTs, our labs, and CCDs that we've received. So how can users access clinical reporting? The application or service is available directly on the HIE portal. It is a secure role-based access, meaning that if you are not credentialed to have access to the HIE portal, you will not be able to access the reports. If the POC, such as yourselves, if you have not credentialed a user to receive access to clinical reporting, the individuals at your organizations will not be able to access. And so it is role based. You all are in control of who receives access to this particular reporting suite. We are leveraging Role Manager as the credentialing mechanism for clinical reporting because you are very comfortable and familiar with using Role Manager to credential the existing CRS reports. And so, why not make it somewhat of a one stop shop for all reporting needs, where users in who you would credential for CRS reports, you can now just add an additional application to their access. We will do it at the organization level for you, but it is just a matter of assigning the additional reports or role profiles. And so access is governed through Role Manager, basically to ensure appropriate permissions. We put that at your hands. And so Role Manager POCs will credential the users, and the report access will be handled directly from Chris. So leveraging the Role Manager for user access. What does that entail? What are the steps? We are going to review from the very beginning, from the HIE admin role through the Role Manager process. I have some slides that have some diagrams. If you're someone who learns using flowcharts, I have a few flowcharts that we can walk through, and I will dive into a live demo. If you are here today, it means you are more than likely familiar with Role Manager. So Role Manager and clinical reporting. Reports Role Manager is the tile that you will use and access to provide, to credential your colleagues access to clinical reporting. Within Role Manager, there are some key terms. There's report application, which is the actual reporting service that is utilized by the end user. CRISP takes care of assigning that application to the organization. The roles are the groupings of reports within the application, and it shares the similar attributes. So, for example, panel demographics or the hospital revisit report, which we've just reviewed, those would fall under a particular role or grouping. The role profile is a collection of those roles. So it's possible that your organization has been assigned a role that contains one report, such as the hospital revisit report, or your organization is credentialed a role profile that contains both reports. Um, that is to be determined internally at CRISP and also in conjunction with the organization for purpose and usage. Organizations is another term that you'll see within the role manager tool, reports role manager tool. Organization contains the collection of roles and role profiles that are typically assigned to the user. At this time, since this is our initial launch, majority of your organizations have been credentialed with the hospital revisit report. Upon request, if there's interest in the panel demographic, we can certainly assign any additional reports and access. I did mention that we are currently working on two new reports and failed to mention the names of those two reports. One is the diabetes prevention and control, where we're looking at A1C results as well as EGFR and UACR results. Very dynamic report, will be absolutely amazing for depending on your population and the services that you offer at your organization. But if you are targeting patients with diabetes, pre-diabetics, then that report is going to be an amazing addition to your workflow. Our second report that we are looking forward to launching is a skilled nursing length of stay facility report, where you're able to determine how long the beneficiaries length of stay, how long the beneficiaries are staying at the hospital prior to being transferred to a skilled nursing facility, and how long they're staying at that skilled nursing facility. So if you have an interest in understanding the duration, this would be a wonderful report to add to um, your day-to-day workflows as well. Lastly, we have the organizational default profile. This is, again, something that we take care of for you internally. It is the role profile that you have selected and said, hey, I have an interest in this report. We will assign it at an organizational level to make it easy for POCs to credential and assign to other users. So, somewhat of a two-part process for receiving access. Within the HIE admin tool, if you are credentialing an existing user, it is a matter of selecting that user's account and selecting service management. Within service management, you will select assign services. Once you select the assign services button, you will have the option of a series of services that CRISP offers. You will look and identify the clinical reporting tile within the service management. Once you've select assign, you will follow the additional prompts and assign that particular service to the user. The second step is to navigate over to Reports Role Manager on your dashboard as the POC. If you are credentialing an existing user, then that user is already on your list of users. So it's just a matter of navigating to that user's account and assigning clinical reporting and the role profiles. If you are creating a brand new user, you will select the create user functionality highlighted in yellow and credential that individual. So the process that we're going to walk through is for a brand new user. Once you've selected the create user, of course, you would enter their email, select the search functionality, the fields, first name, last name, phone number, contact ID will automatically populate. If for any reason the phone number is blank, that's okay. It just means that their HIE admin account does not have a phone number associated. Um, the next field that you will need to select is the primary organization. You'll select the drop down and you will select which organization that particular user is assigned to. Most organizations have one. Most POCs have one, but there are POCs that have a list of organizations that they are POCs of. And therefore, that individual, that POC, would need to ensure that they are selecting the appropriate organization to assign to that user. All users, all end users are um, assigned the end user role. Once you've selected the end user role, the next step will be to select save. Once you've clicked save, the next tile or tab that will become available is the applications role at the very top here next to user details. Once application roles becomes available to you as the POC, you will select either organization or role profile and select view and add. Once you select view and add, the next step will be to it will automatically navigate you to the configuration page, the role configuration. You will select add profiles. Once you've selected add profiles, last step is to click save. Now, these are steps that you've taken previously when assigning CRS reports. They are the exact same steps, except we are now doing it for the clinical reporting tools application. You'll know that you're assigning clinical reporting tools because of the naming of the actual role. So you'll see IMHS perinatal or MDH, IMHS perinatal referral or panel demographic or hospital revisit or the diabetes report. So that's another way for you to identify if you're assigning the appropriate role profiles. To remove any roles or reports for a specific user, let's say the user no longer requires access to CRISP in general or no longer requires access to the clinical reporting tool, more specifically, the trash cans in the role configuration page and that user's account allows for you to remove any roles or reports associated with clinical reporting. So you would select yes, and that will remove the associated or attributed roles. All right. So let's dive into workflows. We've gone ahead and created, I believe, 3 workflows. Let's say there's a new HIE admin at your organization, a new user, or an existing user. Our first is the new HIE admin reports role manager POC credentialing. So this is an individual who's brand new at your org and they are now receiving access to the HIE admin tool. That individual would, of course, engage with a Maryland account manager or our technical support team. Our team would submit an internal request for that individual to be assigned HIE admin tool as well as the role manager POC. A lot of our conversations happen via email, and within those emails, we're sure, we guarantee that there would be communication regarding what the organization would like to receive access to. Clinical reporting will be and is currently an HIE admin assignable tool. Therefore, within conversation, our Maryland account manager and TUS team would confirm if you require clinical reporting. Once the ticket is submitted internally, our team again will verify, validate, confirm access, and inform our CRS team that we now have a new organization and user requesting access, and please credential the clinical reporting suite of reports and role manager at an org level and allow access to the reports. For a new user, the organization has an existing POC and HIE admin. The HIE admin has access to portal and the HIE admin tool. The role manager, reports role manager POC has access to the HIE admin tool. That individual would walk through this process where they would log into the HIE portal, select the HIE admin tool, assign the services, the clinical reporting services to the user's account and create an account for that user and move through the process of credentialing the user through Role Manager. Once the user now has a new HIE portal account, the role manager will go into Reports Role Manager and assign the role, which would be the reports. The end user logs into the HIE portal once the HIE admin, has confirmed, I created an account for you in HIE portal. I've also credentialed you in Role Manager with the clinical reporting suite. The user will then log into the HIE portal, select the clinical reporting tile, and view the assigned reports. That is the process for a new user. Now, let's say you are credentialing an existing user, someone who already has access to the HIE portal and is perhaps already credentialed in Role Manager to access CRS reports. Well, that workflow is very similar to what you currently follow. You would log into the portal, select the HIE admin tool, and assign the service clinical reporting to the users. Step 2, select Reports Manager. Once the user is set up in the HIE admin tool with the clinical reporting service, the next step is to dive into the Reports Role Manager and assign the clinical reporting role profiles or reports to that user. Once that is done, the user would log into Portal and they will see the clinical reporting tile, which was assigned from the HIE admin tool, as well as the reports, which were assigned from the Reports Role Manager tile. So that is the workflow for an existing user. What are the takeaways and what are some of the resources that we have available? As Kevin mentioned early in our call today, we have 2 more sessions scheduled, one this Thursday on the 21st and another on the 27th. So after the holidays, we will hold another session. Please do not hesitate to reach out to say, hey, Francesca, I need another walkthrough. I will be more than happy to work with you one-on-one or provide you with any additional material and assistance as needed. So our goal is to help in your understanding of the user access and credentialing process. Also, to assist in familiarizing yourself with the tool and any of the existing reports, which I will demo shortly. And again, never hesitate to ask. We have developed a Role Manager user guide, a clinical reporting user guide for the two existing reports. You can reach out to us at report-support@crisphealth.org or directly through our technical support, which is support@crisphealth.org. We've covered a lot today. Let's dive into our demo. And thank you all again for registering for our first session. I've timed out. I will log back in. Perfect. So here we are on our dashboard. Our first step in the credentialing process is to navigate to our HIE admin tool. Within the HIE admin tool, we will navigate to our user. So I will select a user from our list of users. I see that I have test order by here. And once I've pulled up the user's account, I will navigate over to the right tab, most right tab of my screen here, Service Management. And once I select, I have the option of selecting Assign Services, the first button at the top. Once I've selected Assign Services, I can then scroll down and search for Clinical Reporting. I will select Clinical Reporting, click Next, and the service has now been added to the user account. I'll select Finish, and I can confirm that the user has access to the application by selecting Related, and we can see that the product is listed as Clinical Reporting. The status is active. Once I've assigned the user with the Clinical Reporting tile, I can easily navigate using our left panel to our Reports Role Manager tool. On my demo account, it's called Crisp Role Manager, but for you, it will be Reports Role Manager. Once I've selected Reports Role Manager, the name of the organization that will populate for each individual user, of course, or POC, is, of course, the name of the organization that you manage. And from there, I can either create a new user by walking through the process that we went through. So Kevin, I think I'll use you as my test. Phillips. I hope you don't mind.
Oh, no S.
No less.
Yeah, yeah, yeah.
Perfect.
There we
Okay. And search. Kevin's information will populate. I can see he has an organization as Chris. I can easily add Chris Clinical just to search for the exact org. And he is being credentialed as an end user. I will select Save. I have now created a new user account for Kevin. At that user account, I will select organization. And again, the name of my organization is Chris Clinical. Once I've selected the org, I will add, I will select view and add. Now for you, it's possible that you will select the role profile as a POC. All of these reports are currently available, and I am ready to add the profile to Kevin's account. I will select save, validate, confirm, and now Kevin will have access to the reports. Of course, Kevin won't have access to the reports currently because I did not credential Kevin um, in the HIE admin tool. So the two do go hand in hand. I'll select cancel just for today. And that is the full process of credentialing in the HIE admin tool as well as role manager. Now, what do our clinical reporting tools, what do they look like? What are we what are we providing access to? As I mentioned, we currently have a few reports available. These are all data, demo data in our reports. And unfortunately, I'm not able to access. I will stop sharing just for a moment. And while I try to access, do we have any questions currently in the chat, Kevin?
Yeah, we have one so far.
Okay.
Mary asked, does the person making these changes need to be the organizational POC?
Yes. We have to credential the org POC with access to the two applications, the HIE admin tool as well as the reports role manager. And so that individual does have to be designated as someone who can play that the role and take on the responsibilities of
And
credentialing access.
I'll follow up too on if you need to make any changes to who is your admin and POC or individual, you can reach out to our support staff and we can help work through getting those approvals in place to make adjustments. Organizations also can have multiple points of contact and admins if need be. So if you feel like you're not the right person or someone else at your organization can do it better, or is better suited to it, you can work with us and we can make some changes to best support your organization.
Thank you
That's
for
the only
that, Kevin.
question we got so far, but if folks have additional ones, you can feel free to use the Q&A feature.
Thank you. Can you see my screen? Are you able to see my screen?
Yeah.
All right,
Yes.
perfect. Let's see if there's some data here. All right, looks like we are able to. I will do my best. This is, all right, still loading. This is our panel demographics. This is a new tool, and so we are currently updating the look and feel of the dashboard. There are additional features that we're also adding in each of our reports. Currently, what you're seeing here at the top is our last refresh date and a panel selection functionality, which we would really love to have available in the reports to allow users to select between panels. There are organizations that have multiple panels, and so we would love to be able to offer that functionality to everyone. We do have a clear all filters that generally applies only to the filters that you see within the report. So once you select clear all filters, it will only clear the filters that have been selected. If you selected within the dashboard, for example, you clicked in one of the bar graphs, you would need to re-click within the chart itself to revert back to the default state of the report. In our notes and definitions, we we thought it would be very handy and good to have somewhat of a notes and definition, uh, an area within the report that provides some additional details around the logic that is being used for the report, as well as um, terminologies that are used within each of the reports. And we're also providing any links to measures that are being used in the reports as well. You're able to easily navigate back to the dashboard through the buttons. Within each of the filters, obviously, there is a drop down functionality where you're able to select. And once you select, of course, it pulls the targeted group that you've identified within each of the sections. And so here you have the ability to multi-select within each of the filters or within each of the drop-down categories and really create that targeted pool of patients to conduct outreach. So we have our chart, an age distribution, a race distribution, ethnicity, patient location, language distribution within your population, gender distribution, the prevalence of chronic conditions. And so you're able to very quickly determine which chronic conditions are the most prevalent in your population. And a patient roster. This is a table that is exportable. And so if you would like to work in Excel to export this table, you would be able to do so. To close out of the report, you can easily select the close report functionality, and that will take you back to our main landing page or home page for the reports. And our second report is the hospital revisit report. Patients, users are able to track patients who have returned to the hospital within a defined time frame after an initial visit. This helps identify patterns in readmissions and supports strategies for improving care transitions and reducing avoidable visits. Within the main dashboard, users are provided with a series of static tiles that highlight the total patient, the total initial hospital visit, the hospital revisit rate, the total hospital revisits, and the total patient count. In addition, there are filters that allow for the analysis of targeted populations. For example, if you would like to select a specific initial hospital visit, uh, users would have the opportunity to refine their search by initial hospital visit, revisits within 2 to 30 days, long-term care facility names, and discharge dispositions, as well as revisit patient class. There are some demographic filters that allow for users to filter by race, ethnicity, and age group. Within the body of the dashboard, the charts that are provided are the revisit rate chart. The revisit patient class percentage chart is presented as a pie chart that offers a unique perspective on the distribution of revisits across the three patient classes. The patient count by number of revisit chart represents the number of patients who have a specific number of revisits within the selected time frame or the last refresh date. The revisit rate by initial hospital and the revisit rate by long-term care facility charts allow for users to identify the rates by initial hospital as well as long-term care facilities. And the initial hospital discharge disposition will provide details on the disposition of the beneficiary once discharged from their initial hospital visit. At the very bottom, we have a patient revisit details card that provides information on the patient ID, the initial hospital by patient class, the initial hospital admit date, hospital discharge date, and initial hospital length of stay. In addition to the charts, the filters, and the static cards, all of our reports contain a data dictionary that provides users with terms and definitions that are used within the report for better understanding of the data. Additionally, organizations will have the ability to select panels through the multi-select panel selection. To clear all filters that have been selected, we have a clear all filters button that users can use to remove and return to the default state or status of the report.